Hi, everyone. Oh, wait. No. I hit record. Start broadcast. Hi, everyone. Thank you for joining us for the 2024 mid-year performance reviews. We're going to help you drive employee growth and boost retention. But first, before I tell you about anything that we're going to talk about today, I want to introduce to you our speaker, and that is Lauren, who is our product manager at HR for Health, and she began her career here 9 years ago as an HR specialist. She quickly developed an interest in problem solving through our software, eventually becoming the product manager. In this role, she loves solving problems for our clients and making their lives easier one HR task at a time. So she's had the background in HR and she has the tech experience, and she's taken both of those things and her love for healthcare and put them together to make HR for Health the best software for you to use for your practice. And how that links today to performance reviews is we want to check in with all of you and make sure you're getting them done because they are extremely important to retention and engagement at your practice. And so today, to cover that, we will go through the first point, which is understanding what is the point of performance reviews, why do we do them, why are they necessary, and why do we make such a big deal about them. And then two, we're going to learn some best practices for conducting reviews because there is a right and wrong way of conducting performance reviews. There's some things you should say, some things you shouldn't say because you are still at work. So you have to ask the right questions and the most appropriate questions. And then, of course, it would not be a webinar without having a section, how our software does this for you. We want to make sure that when we're telling you how to give performance reviews, we give you a solution on what's the most compliant way to give these, because we are always making sure that you understand that you have to document everything that you do with an employee. You have to make sure it goes into a system, it's time-stamped, and there's no disputing it if anything were to come out HR related. And so having an HR software is the most compliant way to make sure that you are helping your employees, but doing it in a safe and legal way. So with all of that, I hope you are mildly excited for performance reviews. I know it's not the most fun topic ever, but you can make it really fun and you can make it enjoyable, and you will see that it boosts morale across your practice if you make sure to get these done throughout the year. So with that, I'm going to hand it over to Lauren, who's going to kick us off today.
Awesome. Thank you, Taylor. Yes, I know performance reviews probably aren't the most exciting thing, but it's something that is super helpful for your practice, really crucial for your employees and making sure that you're retaining them, putting them on growth paths. So stick with me. I have some specific examples that we can go through on how you can actually apply it in your practice. So we'll go over some basics and then we'll get into the nitty gritty. Okay, so first, why are performance reviews important? The first one is employee growth. So that links directly to employee retention. We know that it's super hard to find good employees. We want to make sure that we're keeping our good ones because it can be so costly when there's turnover and you're having to retrain and all of that fun stuff. And then it's hard to find a new employee to replace them. So we want to make sure that we're focusing on how we can grow our employees, whether that's into a new position, maybe a more senior position, new skills that they might be learning. How do we continue to develop our team? So you want to make sure that you're including those in your performance reviews. The next one is performance documentation. So if you unfortunately have somebody that's not performing very well, you want to make sure that that's documented so that if you do have to let them go because of performance, everything is time-stamped, it's very objective, job-related, and you're not just firing them and then they come back and say that they were fired for a discriminatory reason. So you want to make sure that you have all of that documented and time-stamped. Employee transparency is really crucial, and we talk about this with everything in our software. You want to make sure that your team knows exactly where they stand, how they're doing, how they're performing, whether that's positive or negative. I think a lot of people hear performance reviews and it sounds like, oh no, they're going to tell me why I'm so bad, or even from a manager's perspective, it can be very intimidating to give feedback. But it doesn't always have to be a bad thing. You want to encourage your team when they're doing really well as well. So employees should never question where they stand with you. They should know exactly what they're doing well, what they need to improve on, so on and so forth. And then again, all of this goes back to retention. You want to make sure that you're communicating clearly with your team and making sure that you're keeping them. if you want to keep them, keeping your good employees. Okay, so what does that all mean? What are some tips for how you can do a successful performance review? So we want to set your team up for success. We recommend doing an introductory period review. So typically, an intro period would be the first 90 days of employment. So this is when you are training your team member, getting them acquainted with the practice, making sure that they have everything set up to be successful with the practice. And this is really a good time to just check in and see, how is training going? Where do they need more training? Are there any gaps? Do they feel supported? Really just a good check-in to start off your employment with them successfully. So we do have a template for this. So I'll go over that when we go into the software. So you don't have to think about, wait, what am I supposed to be asking them? What am I supposed to be rating them on? We have a template for you that you can edit from there. You also want to make sure you're doing a consistent time frame. So there's not any rules around when you need to do performance reviews. Some practices like to do the intro period and then annually on their anniversary, every anniversary year. Some like to do mid-year. So like right now when we're coming up on July 1st, they just want to knock them out all at once. So it's really just personal preference if you'd rather just do them all at once or if you'd rather space them out based on anniversaries. You just want to make sure that you're consistently doing it with all of your team members. Another thing is employee self-review. So it honestly makes it a little bit less intimidating for both parties as well, because the employee is also reviewing themselves on the same data and questions that you are as the employer or manager. So then you can also see if there's any gaps on, oh, they think they're doing really well on this, or they think that they could improve. So really just making sure that you guys are on the same page there. So that helps a lot with just, seeing how they rate themselves and how that compares to how you rate them. And that goes with the transparency as well. So that's a really crucial step of the review process as well. And then you also want to make sure you're documenting throughout the year. I know it's a lot to keep track of when you have the whole staff of team members and you're not remembering what they did and when they did it. So you want to make sure you're documenting, what they did well throughout the year, what they need to improve on. That doesn't mean that you should wait to talk to them about all of those things all in one place or all in the review. But it is good to have that documentation so that you can easily reference it when the review time comes. Okay, so essential elements of a good review. So what should you include in that review? So we recommend having at least these 4 checklist items in your review. You first want to review their strengths, so what they're doing well, what they've accomplished the last year period or however long your review period is. If it's every 6 months, it'd be 6 months. Areas of improvement. So obviously that's probably what most of us think of when we're thinking about performance reviews. But where can they improve? And then going over specifics on how they can improve it. You also want to set future goals. So this helps honestly with employee growth, retention, making sure that they have something to strive towards. You want to make sure it's very specific goals so that they know exactly how it's attainable instead of just a general, support more patients. It's helpful to have numbers. I'm sure most of you have heard about the SMART goals. You want to make sure that it's a measurable goal that they can attain. And then the last one is support. So really checking in with the employee. How can we best support you? Are there any other resources we can provide you with? Is there training that we can give you? Just making sure that they feel supported to do their job duties to the best of their abilities and figuring out if there's anything that you as their manager or the practice can do for them. And again, that just helps with retention overall. Okay, so then consistency. You probably hear this on all of our webinars. We want to make sure that everything you're doing is consistent across all of your team members. That's just going to make your life in general a lot easier, but it's going to be the safest from a compliance perspective as well. So making sure that you're asking the same questions. It doesn't have to be the same questions for different roles. So you can ask your hygienist different questions than your dental assistant, but you want to make sure that they're consistent within the departments. Consistent timing, I mentioned that already, so making sure that you're doing them yearly for everyone or whatever your cadence is. The next one is data-driven review and insights. So you want to make sure that it's all very factual, objective, related directly to their job. You don't want to bring I know it's hard not to, but you don't want to bring emotions into these things. You want to support it with like specific data whenever you can and that documentation so that it's clear, hey, here's where you need to improve and here's what the data shows. Again, numbers are super helpful, but any documentation that you can provide there is incredibly helpful. And we'll go over some tools that we have to help you there as well. Okay, so staying compliant and fair. So how can performance reviews protect you and your practice? So I mentioned earlier, we want to make sure that everything is documented clearly on if they have poor performance or if there's anything that they need to improve on. We want to make sure that's documented and time-stamped so that if you do end up terminating them for that reason, they can't come back and say that they were terminated for a discriminatory reason. We also want to make sure that your employees are protected and you're, again, consistent with everyone on each team, asking the same questions, doing the same cadence of performance reviews. So it really goes both ways. We want to make sure you're not discriminating against your employees, but then also proving that you were following the FAIR guidelines and doing everything by the books as well. And we do in our software have built-in compliance tools to make sure that you're following this as well. So we'll go through a lot of those in the demo portion as well. Okay, so real world application. So how do we actually implement this? How do we address issues that might come up with our team members? So one of the top concerns we always hear is employee tardiness. So employees are always late. What do I do about it? How do I track it? All of that fun stuff. Of course, we don't want them to be late because that affects patient care, then it delays the rest of the patients, and it's just kind of annoying. So we want to make sure that we're nipping that as soon as we can. So that's crucial. That would be a really good thing to bring up during the performance review on the areas of improvement section. So the issue is the employee is always late. The feedback, so again, we want to be super specific when we can. So the feedback could be something like, you were late 3 times in the past 30 days. Our policy states that excessive tardiness is anything more than 1 tardy per month. So again, we're specifically giving the facts. There's no emotions about, it's really annoying when you're late. It's a specific, no, you were late 3 times in the past 30 days. So you want to make sure that you have that documentation easily accessible so that you can provide it for them during this review. And then we're also referencing our handbook policy. So it's really important to bring in your policies whenever you can, and even quoting them in some cases, like, here's the specific policy that states this. They all should have access to your handbook. So I'll go over that in the software as well. They should have access to the policy. They know exactly what those expectations are of them, so there's no questioning. And then you're referencing it again just to bring it full circle for them to see, hey, you're actually not following our policy here. And then in the demo, not to keep mentioning the demo, but I will show a lot of things. I'll show you our attendance tracking feature so that you can easily pull this data and present it to them if needed. All right, what's the next one? So an inefficient employee. So maybe they're taking a lot longer than the rest of the employees on their team to, add patient notes, or maybe it's a hygienist that's just taking a long time to see the patient, whatever it might be. You want to provide specific examples. So, this is our average, patient time. This is what yours has been over the last 3 months. But you also want to be empathetic with them. So ask them questions like, is there anything that we can do to help you improve the efficiency? Or do you need additional tools? Do you need additional training? So it's really a two-way street instead of you just saying, hey, you need to do this faster, because that's typically not going to be well received on the employee's end. You want to make sure that they feel supported and that it's a partnership, and then you're figuring out the solution together. So again, be as specific as you can here, and then offer additional support if you can. Okay, another one that we hear a lot is employees working unapproved overtime. Also, just a quick tip, because we hear it so often. Do you have to pay for unapproved overtime? The answer is yes. So anytime an employee is working overtime, you have to pay for that time. Any hours worked are paid, but that doesn't mean that you have to allow it to happen. So this one you probably want to address it sooner than the performance review, but it's still worth mentioning in the improvement section of the review. But this one you'd probably want to do more of a violation if it's a recurring thing, because obviously it's going to be more expensive if you wait until the review every year. But an example would be you have worked 8 hours of unapproved overtime the past month, according to our policy. Again, looping it back to your handbook policy. Any overtime over 10 minutes per day needs to be approved by your manager. So here you want to specifically reference the handbook policy, give a specific example of what they have done to break the policy. So that, again, it's very objective, factual. It's not just an emotional, hey, you're working too much overtime. You're giving them specifics and realigning them on what your policy specifically is. Okay, so using HR Health performance review tools, how can we make all of this easier for you so you don't have to think so much about it? Like I mentioned, we do offer templates, so performance review templates that you can edit yourself. You can create your own if you want, but at least gives you a baseline so that you're not starting all from scratch. Attendance and overtime tracking, so we have tools in place so that you can track both of these things. If either of them become an issue, it's really easy to pull that documentation. And then accessing and documenting notes. So we have violation tracking, notes tracking where the employee can't see the notes that you're taking for them. Really just want to make sure that you have a plethora of options available for documenting performance issues, violations that they may be breaking, handbook policies, whatever it might be. We want to make sure you have all the tools needed to document all of those things. Okay, so without further ado, let's get into the software. So I'm going to go ahead and log in here. And we'll get into the specifics on what all of this looks like. So first, I just wanted to highlight really quickly what our dashboard has. So an employee, every time that they log in, they'll see the to-dos that they have to complete. So if I'm an employee and I log in, I can see, if I click on my document section, I can see that I have a job description waiting for my confirmation. And I also have a handbook waiting for my confirmation. So these two things alone, and then also all my new hire documents that I need to sign. So in this case, I would be a new employee logging in, and then I would see everything that I need to sign from the practice. I wanted to bring this up is because we do have job description templates based on your specific industry, and that's crucial as well to make sure that you're setting expectations on what you want the employee to do in their job duties, explicitly stating, here's what you need to do, here's what's included in your job description. And again, that just helps in the performance review process in general. So referencing that whenever you can in the review process is also incredibly helpful. And then they'll also all get a copy of the employee handbook, and it'll let them know that they need to sign it. So again, there's no questions on, I never got the handbook, or I don't have access to the handbook. It's going to automatically send it to them when they register. So every employee has a copy of it. They can reference it whenever they need to as well. All right, so let's jump into the actual performance review templates. So these are the three that we have available. Annual is just, again, if you wanted to do it every anniversary year or every July 1st, whatever works best for your practice. Interim would be if there's something that came up specifically that you want to do a review on. Maybe your employee is in the process of working towards a promotion, so you want to do a check-in, more of a development plan. Development plans don't always have to be a negative thing. It could be developing them into a new position. So that could be a case where you'd want to use an interim. And then probationary review would just be that 90-day check-in. So just, hey, how's it going? How are you rating yourselves? Do you need additional training on anything there? And then from here, so let's say I have someone in their probationary period, I would just go ahead and click send. I would select who the manager is. So let's say Kamira is the manager and Annie Smith is the new employee. I can send it here. And then if you were sending out your performance reviews to everybody, you could actually say, so Bryn is the manager, maybe she's the office manager, and then all of your employees are doing their performance review at once. So you can select all. Obviously, she can't review herself, so we'll delete her there. But this would send all of the performance reviews for your employees in one swoop, so you don't have to think about who did I send it to? I'm not sure. I need to go check. You can just do it all from here. So if you're an existing client and you haven't used these templates yet, I highly recommend checking them out. You can also edit them, like I mentioned. So this is our annual one. You can click edit. You can add ratings based on like a 1 to 4 scale. You can do a 1 to 5 scale. Some people just have preferences on 1 to 4 or 1 to 5. So you have that option there. And then you can also choose a text box. So a text box would allow them to enter their answer. So at the bottom of our templates, we have a bunch of questions that allow them to type out their answer. And then it also allows you to type out your answer as the manager as well. So this is what we have preset, but again, you can, if you totally don't like a whole section, you can delete it. You can change the name of each section. So if you wanted it to be, for your optometrists, you could say something specific to them up here. You could change any of these to be more specific to each position. So if you want to use this as your guidelines and make it more specific to either the position or the practice, you can do that in here. You can drag and drop the order. Again, just in general, very customizable. We've also had clients that do different types of reviews. So they might do stay interviews. So you can completely create your own templates here. So it doesn't just have to be those 3 that we have. You can create one from scratch here. So if I wanted to do stay interviews, and then you can add the description, you can create yours directly from scratch, send it out the same way that you do for your other reviews. So it doesn't necessarily always have to be a performance review. You can really use these however you see fit to make sure that you're engaging your employees and really focusing on retention. All right, so the employee themselves will get an alert on their dashboard. Again, everything they need to do is going to be on their dashboard. They'll get an alert that says there's a performance review waiting for them to complete. So me as an employee, this is saying that I have a review to complete. So I'll go ahead and click in here. I'm going to complete this for myself. So the employee does their self-review first, and then it sends to the manager to do their review. So I could just go in and click all of these things, but this is what it's going to look like for the employee. They can type out what their responses are to the free text boxes here. And then once they submit, then that submits to their manager. The manager then completes their portion. The screen looks the same on their end. And then once it's completed, there's a section for meeting notes. So you can say anything that was discussed during the performance review. Maybe it was a raise. Maybe it was something that they needed to improve on. Anything that came out of the meeting, you want to make sure that you're documenting that. You want to document when the actual meeting was. So we give you all of those fields so that you can make sure everything is tracked in HR for Health. And then it sends to the employee to sign it. So again, there's no world where the employee can say that they never received it. It's all very clear, again, promoting that transparency in your practice. They know exactly where they stand, and you have both their self-review and your review all in one place. So you can go ahead and see, again, you would see all of their performance reviews. So hopefully you're doing this consistently, and then you'll have a list of all of their reviews over the years. I know when I specifically manage employees, it's helpful to see the previous year to see, okay, what were your goals? Did they achieve them? It's just nice to see what the growth has been since the previous year and just have that documentation all in one place. So I highly recommend continuing to do these, and then it's easy just to reference back on those previous years because it's all in one place for you here. All right, and then I did want to go over some of the documentation tools that we have in place. So just from a high level, violations, I mentioned a couple of times, so I just wanted to show them here. You can add things like a tardiness violation, maybe it was a performance issue, maybe it was a safety issue. You want to make sure that all of those things are clearly documented. We recommend referencing any policies you have in place whenever possible. Again, just keeping it as objective and emotion-free as possible. So that's really important in terms of having documentation in place for your team. And then another thing I wanted to show is the notes section. So this is one of our test accounts. So Annie has been really annoying lately. We probably wouldn't want to add that in there, but you could because the employee cannot see it. But something that would probably be more helpful is I spoke to Annie about her tardiness problem. This was documented on September 5th, 2023. Only you as the manager can see this. So if there's just a informal conversation, maybe it hasn't escalated to a violation yet, so you just want to make note of it, but it doesn't need to be brought up to the employee's attention yet. You can just go ahead and add a note here. We also have the ability to attach a file to the note. So maybe there was a text conversation that you want to add a screenshot of. Maybe there's a document that's related to it that you want to attach here. You can attach it here and the employee will not have access to it. So this can be a super helpful tool just for documentation in general. It also doesn't always have to be a negative thing. Just want to clarify that as well. You can add, if this is how you want to add tracking throughout the year on how their goals are going, things that they're doing really well, so that when you do the performance review, it's all in one place for you. You can use it for that as well. So really use it however you see fit. The employee does not have access to this, so the world is your oyster here. Okay, cool. And I know I brought up the handbook a couple times, so I just wanted to show you from a high level what that looks like. We do have a state-specific handbook that's generated based on the state that you're in for your practice. And once you answer all of the questions in our questionnaire, the handbook will generate automatically for you. But let's say you have an issue with overtime. Actually, I'm going to use the search function. And you're wondering, oh, this employee has an issue with overtime, but I'm not sure what our policy is. You can use the search bar and then look to see what your policy says. So we have a specific overtime for non-exempt employees. You can click here. It's going to automatically highlight that word that you were searching for. So this specifically goes over all of the rules that you have in place for overtime. Again, we're going to automatically add this to your handbook, but you can edit it as you see fit. So if you wanted to tweak something, you can just click edit and tweak it there. But it'll specifically say in our default policy that all overtime must be authorized by whoever you add as the contact. So it has to be approved by the office manager or the doctor or whoever it is. So that's all going to be automatically implemented for you. And then you can easily just copy and paste this into something like the violation or the performance review because it's all right there for you. And then once everything looks good here, or you're just looking to reference something, you can actually just send it to all of your team members like I showed on the dashboard. They'll get a receipt of it, and then they electronically sign it saying that they acknowledged receipt of it. All right, I think that's all on the documentation side, but, oh, no, it's not. I want to go over our employee scheduler is really crucial in terms of tracking our attendance for our employees. So tracking both tardiness, so if they show up later than when they were expected to show up, and if they don't show up at all. So we have the ability to track no-shows. So you can see here, this is my team's schedule for the week. Employees have access to this. They can see when they're scheduled. They can see if they have any meal breaks that are scheduled for the day. So if you're in a state that requires meal breaks, this is super helpful in making sure that you're protected and showing that you're offering these breaks. Especially in states like California where they're pretty strict. This is, if you're adding their meal breaks here, it's essentially a foolproof way to make sure that you're protected because you just have to make sure you're offering it to them. Same for rest breaks as well. So just really quickly, I can show you, you can add these 10-minute rest breaks if you're in a state that has those, and then the employee will see that they have those available for them. So in our settings section, you can set what you want your tardiness settings to be. So a lot of times our clients won't, if they start at 8 a.m., they're not going to mark them as tardy right at 8 a.m. They want to give some sort of grace period. Maybe there was traffic. Maybe there was something happening in the parking lot. Whatever it might be, you're okay with them being at least 5 minutes late. So here you can add 5 minutes. it's not going to mark them as a tardy until they clock in past 8:05 in this example. So we give them a little bit of a buffer, but if they're past 8:05, then they're marked as a tardy. The next one is a no-show. So this is if the employee just doesn't show up for their shift that it was scheduled for that day. So you can set up those parameters here as well. So this one is 60 minutes. So if they don't clock in the first 60 minutes of their shift, it's marking them as a no-show, but you can customize that whatever you want here. And then you want to make sure that you're assigning it to all of your team members so that it's automatically applying to them as they're clocking in and out. Another thing just I want to note really quickly is you can also customize if you're getting an email about these things. I know sometimes managers love getting emailed about every single thing. Sometimes they're like, please don't email me one more time. So you do have the ability to customize if you want to be notified via email for a tardy or a no-show so that you can address it right then and there. Or if you don't want the emails, you can still see it on the employee's attendance page. So either way, you still have that documentation. And then we also do have a notification in place that if an employee clocks in too early, so I know we talked about overtime being an issue, this is something that you can implement to help prevent employees from clocking in too early. Because if they clock in 10 minutes early every single day, then obviously that's going to result in overtime. So you want to make sure that you're limiting that as much as possible. So this allows you to be more proactive on that approach as well. Okay, cool. So once all of those settings are set up, if an employee, so I'm scheduled for 9 a.m. all of this week, and the tardiness threshold is 5 minutes. So if I click clock in, it's going to tell them, looks like you're late. Please add a note explaining the reason for your tardy. So the employee actually gets directed to their attendance page, and then they need to add a note on why they're tardy. So sometimes just seeing this page alone was like, oh, that's enough for them to not be tardy again, because no one wants to see like right away that that they were late. So we've even had people say like, oh yeah, I got the tardy notice and then I didn't want to be late again, or I didn't stop for Starbucks because I didn't want to get that pop-up again. So the employee will see all of their tardies here. So let me go to mine. Oh, it's mad at me. I was late too many times. But it'll show you all of the no-shows and tardies on that page. So again, when you go to your performance reviews, it's going to make it really easy to document all of those things. Okay. Perfect. So you can see here that I had the tardy. I can then add a note, and then you as the manager can either excuse or unexcuse it. So there's always going to be cases where maybe they were excused. It was in one-off scenario, so you can excuse those. And then you can also filter by how many tardies, how many no-shows, what the status is. So if it's excused, unexcused, or pending. And then you can also do a date range. So like I showed in the performance reviews example, if you wanted to look at the last 6 months, last 3 months, we have these default options for you. Or you can customize the date range that you want to look at from there. Especially if you have improvement goals for them where they can only be tardy once in the next 3 months, that this is going to be super helpful on making sure that you're keeping them accountable. Okay, awesome. I think that is it on the software side. So I will pop it back into our slides here and kick it back to you, Taylor.
Thank you, Lauren. And I apologize for the note that I had left on Annie when I was playing around in the software.
We'll let it slide. Annie, she's okay. She doesn't see it.
So now you can all learn from me. I swear I was playing around in the software. And with that, you can play around. If you don't have our software just yet, download our guide, which is a comprehensive view into performance reviews. You'll get everything that was said here in a written format, in a book, and you can show it to the practice owner if you're looking to advocate for the purchase of HR for Health, or if you're looking to just get a better understanding overall of performance reviews, where to get started, depending on how you learn best, whether it be through text or through this webinar. Check this out and let us know if you have any questions at all. You can email us and we will respond to you with anything that comes up. And I'm going to take that as my moment to transition into some questions that we got from people. If you registered with us, then there was a little response for you all to put what questions you had. And we're going to answer a couple of them today. And the first one is, should reviews be combined with raises? Why or why not?
Yeah, great question. Should they? Yes, I would always recommend having that documentation in place if you're going to give a raise. Specifically, just want to make sure that you're being consistent with all of your team members. But also, it just gives the employee, like, okay, here you've done X, Y, and Z really well. You've met these goals, and here's why you're getting the raise. You don't want to just, hey, you're getting a raise, good job. It also helps the employee to know exactly what they're doing well. But a performance review doesn't necessarily mean that you have to give a raise. Obviously, there's a lot of factors that come into play here, where the financial status of the practice, the employee's performance. Obviously, if they're not doing well, you don't have to give them a raise. I know raise specific questions have been super common. I know we got a lot of questions submitted about it. Typically, on average, we see a 1 to 5% raise given, 5 being like, wow, you're doing outstanding and you want to make sure that you're keeping that employee happy and retaining them. So somewhere in the middle is probably 3% is the average there. Again, not required, but it is helpful to have that performance review documentation in place so that you're specifically showing why you're giving that raise.
Okay, good answer. I like that. The next question also close to raises, but this person asked if they have to increase that salary every year, and if they do, how much on average? So would the average still be the 3% that you mentioned?
Yeah, so averages we see is typically between the 1 to 5. So it really just depends on, how the employee's doing, how the practice is doing, what you're able to provide. No, there are no rules on you have to give an annual raise. I would say if you're able to and the employee is performing well, it's a really big retention tool, especially in today's employment world, where it's so hard to find employees in the healthcare space. So if you have an employee that you really like and you want to keep them, and you can provide the raise financially, then I would highly suggest it. Doesn't mean it always has to be that 5%, but that's typically the average.
Okay. And the last question is, someone wants to know, how do we ask questions that help people see where people are and how they can feel valued?
Yeah, I think that goes back to the support piece of including in your questions. So it's important to really check in with the employee on how they're feeling supported. Is there any other way that the practice can use their skills that they have? Is there anything that they can do to help expand on those skills? Really just you want to kind of gauge the employee happiness as well. You can really use this as a stay interview. It doesn't just have to be a strictly performance review. But you do want to check in, like, how's everything going? Are you happy with your position? Are you happy with X, Y, and Z? Is there anything that we can do to improve? And that can help kind of gauge like what they value in their role, what they value in the practice, and just making sure that you're continuously supporting them there.
Okay, I love it.
I love that they're focused on that. Those are everyone's on the right track.
I know we're talking about money and mental health. I think those are the
Yes.
two best things you could check on.
Support your team and you'll be good. Use
Thank
HR
you,
Help to help you.
everyone, for submitting your questions. When you register today, it really helps us formulate a better slide deck for you and the content that we're going to be creating for you. And if there were anything that we missed, or if this was finally your last straw and making sure that you want to go ahead and get started with HR for Health, you can scan this QR code that's been on your screen, and you can either go ahead and get started with HR for Health, or you can ask us more questions. You can see more of our software and have it done in front of you, and you can get an idea of what it would look like for your practice specifically. But if you have anything outside of that, please reach out to us. I will be following up with all of you through an email that will include a copy of this slide deck. We'll include the performance review guide that we made, and link to this going up on. Watch it again, feel free to. And Thank you, Lauren, so much for your time today, and I look forward to hearing from you all soon. Bye, everyone.
Thanks, everybody. Bye.